While heart disease is declining in men, it is steadily increasing in women. This is due in part to the lifestyle women are now living. Understanding the risk factors and the way to prevent heart disease is what Dr. Warren Johnston will explain in this segment.
Women and heart disease really has been underappreciated. I think it's a public health problem. I find it very interesting that cardiovascular disease became the #1 cause of death in women in 1908. Ironically, that was the first year we celebrated Mother's Day, whereas cardiovascular disease in men has been declining somewhat. Cardiovascular disease in women is actually increasing. And in 1985, more women died of heart disease than men. The public has not appreciated this problem, and I would dare say that women have not appreciated the problem either. If you poll women as to what they think is their most likely cause of death, uniformly they'll say it's cancer. And they'll obviously worry primarily about breast cancer, but certainly ovarian cancer as well. Some 54% of women think they'll get breast cancer. Only 2% of women think they'll get cardiovascular disease. But again, the truth is, it is clearly the leading cause of death in women. One out of every 5 women have some form of cardiovascular disease. If you're a woman over the age of 65, you have 1 in 3 women have cardiovascular disease. And in the age group of women 25 to 44, I mean young women, cardiovascular disease is the 3rd leading cause of death. It's unfortunate that cardiovascular disease is increasing in women. Some of that may well be due to the fact that smoking is increasing in women. And even more troubling, while the incidence of smoking has decreased in general over the population, there's one group that smoking has increased in, and that is teenage women. So it does not bode well for the future. Women tend to be actually more obese than men. Men are usually more overweight, but the incidence of obesity is higher in women. Obesity is linked to the increasing incidence and epidemic, if you will, of diabetes. Women need to know as well that the symptoms that women often present with are different than men. Often they have much more subtle signs and symptoms. They may not have chest pain when they present with angina or a heart attack. They may just have nausea, indigestion, feel weak, be short of breath. If they have chest discomfort, it may be really pretty minor. And that's a typical presentation, much more common in women. And as a result, and women have often been turned away from emergency rooms saying, no, you can't have heart disease, you're a woman, you're too young. Those symptoms just don't sound like heart disease. And as a result, women actually have less non-invasive testing for the presence of cardiovascular disease than men. And actually, I think embarrassingly so for the medical profession perhaps, women who have positive stress tests are much less likely to have heart catheterization, coronary angiography, to have bypass grafting procedures, to have angioplasty done. Also, I think distressing for women is that when women present with heart disease, their outcomes are poorer than men. That is to say, they often, more women die of cardiovascular disease after presentation. In fact, 38% of women will die within a year after having a heart attack, as opposed to only 25% of men dying in the first year. 63% of the time, women were completely asymptomatic prior to having an event. Here at St. Joseph Hospital, we've opened a women's heart center. We actually opened it in December of the year 2002. And our task really is to go out into the community and educate women as to their risk, identify women through screening, blood pressure, sugar, cholesterol, and what have you, who may be at risk for this disease. In some cases, do non-invasive testing and discover occult, non-diagnosed heart disease, and then, of course, treat it appropriately. So this is a center that we have established as being a very important part of our hospital, and I think in consonance with our mission here at the hospital to go out to the community and really see if we can strive to have a healthy community.
Preventing heart disease requires lifestyle changes. Dieting, exercising, and not smoking are the best life-saving options to prevent heart disease. For the American Health Journal, I'm Laura Windsor.